I'm here really to share with you sort of my take on join work. So I am the convener for the Improving Join Work Special Interest Group, and I'm going to give you a brief overview of join work, why I think it's important, and share with you some of the tools which are out there which you can maybe tap into a little bit more. However, before I do have to say that this is the reaction I usually get when I start talking about join work. And this is because people think, well, Julia doesn't know where I work and what I do, and it's absolutely true. I don't. But I do think we spend an awful lot of time at work. So it's really good if we can find meaning in that and we can find joy in the work we do. What I would say is some people find the term join work quite off-putting, and if you're one of those people, I mean, it does jar a little bit with me, I do have to say. So if you're one of those people, think about calling it something else. So for example, East London Foundation Trust call it enjoying work. So we don't have to stick with the terminology. The problem with join work though, and being happy, is that we're actually hardwired to focus on negative things. So as humans, we're hardwired to do that. So we have to intentionally focus on trying to be happy at work as well. So that's just something to be mindful of. I just wondered if you would share with me what brings you joy at work. If you could just pop that into the chat, that would be great. If anyone's willing to share their thoughts on that. Being creative, yeah, brilliant. Connecting with people, sharing meals with colleagues, supporting growth. Yeah, feeling free to organise my own time, that's a really biggie. Learning new things, openness to new ideas. Learning, yeah. There's some great ones in there. And when I've presented this before, what you do find is that the same themes seem to come out regardless of what background you're coming from, regardless of what job you do. It is all these kind of thing, conversations with colleagues. You see, that's another thing. The people who we work with is really key to how happy we are at work as well. So I also wondered what makes you sad or irritated at work. Now, I'm not going to actually ask you to pop that in the chat because it's a very personal thing and you might feel very uncomfortable me asking you to do that. But what I would like you to do is just think about it as we go through this presentation today, and just think about, as we come to the end of it, do you feel that you're more able to influence maybe some of those frustrations you have on a daily basis? So join work is really important, and it's not just because you spend a lot of time at work that we should try and make that as happy as possible. But there's some research behind it, which if you feel that join work is quite fluffy, then what this will do, or if the people who you work with feel it's quite fluffy, share this with them, because what it will do is kind of share the reasons why it's so important. So the first point is that trust with more engaged staff tend to have higher patient satisfaction, which is great, with more patients reporting that they're treated with respect and dignity. So that's fantastic, isn't it? But the problem is purpose-driven work, which many people who work in healthcare and in social care and within charities is very purpose-driven, isn't it? And now that increases engagement, but can also lead to an increased risk of burnout. So there's a tipping point there, which we all need to be mindful of. Now, high levels of stress are associated with errors that can harm patient care, and in the acute sector, it's even associated with higher levels of mortality. Now, I do have to say, the first time I came across that, I couldn't quite believe it until I sat down and really thought about it, and then it started making sense that actually it is definitely something which can happen. And we talk a lot about incivility at the minute, and that's because it's really important, because civil environments really matter, because they reduce errors, they reduce stress, and they foster excellence. And stresses at work can lead to anxiety, anger, unethical behaviour, poor decision making, and chronic exhaustion and burnout. Now, when I'm talking about unethical behaviour, I'm not talking about someone who's intentionally being unethical at work. What I'm talking about is somebody who is doing workarounds because the processes aren't set up right, or someone who is cutting corners because they've got 101 things to do that day. So from a very individual perspective, enjoying work is important because chronic work stress is associated with cardiovascular disease, hypertension, heart attacks, addictions, cancer, diabetes, and more severe mental health problems. So if that is not a driver for us to try and make our working environments better, I'm not sure what is. And there's also compassion fatigue. And those most at risk of compassion fatigue are those medical and mental health providers who are caring day after day for patients. So, and the bottom line is, in the NHS, the most reported reason for sickness and absence is anxiety, stress, depression, and other psychiatric illnesses. So although joy in work is just a small part of the wider working environment, it is something which we should really focus on. So I wondered if any of these applied to you. So the first one is stress relaxing. So being so stressed that relaxing makes you more stressed because you're not working on what's making you stressed. Yes, so I can see a nod there. So that's definitely me too. The next one is micro stresses. So this is when we have, and we're bombarded with numerous small stresses throughout the day. Now, most of us have about 20 to 30 of these on a day, and individually they don't matter at all. But when collectively they happen day after day and you're having, say, 30 micro stresses, then that is an issue. And here is an example. So you leave work, so you're planning on going to work. So I know many of us work virtually now, but for those of you who do work in the office, you're planning on going to work one day and you have a number of stresses before you even leave for work, which means that you leave work late. So that's a micro stress in itself, isn't it? So you leave work late, the traffic is busier because you're later. So that's another micro stress. You get to work and you have to park much further away than you normally do, so it's longer to walk into work. So that's another micro stress. It's raining, so that's another micro stress because by the time you get into work, you're drenched. You then decide that you put on your computer. Say if you're working in an office, a busy office, or on a ward, you put on your computer, but it's taking ages to boot up. So that's a bit of a micro stress, but it's not too worrying because you think, well, I'll go and make a cuppa while I'm waiting. So you go to make a cuppa and there's no teaspoons. Now, I don't know what it is about the NHS. If anyone's worked in the NHS on this call, you will know there's never any teaspoons anywhere. I don't know why. It's not just in the Northeast, it's everywhere across the country. So you're using a knife to try and make your cuppa, and then you go back to your computer and you find that someone else is now using it. So as you can see, that's just an example of all these little micro stresses, which on their own aren't biggies either, but collectively they can cause you a problem if they're happening day after day. The last one I wanted to share with you is meta stress. When you're stressed about having stress. Does that relate to anyone? Because it certainly relates to me. The more busy I get, the more stressed I get, and the more stressed I get about having stress. So thinking of all those reasons why joy in work is important, I did just want to share with you two approaches which are used widely in healthcare. So the first one is 15 seconds, 30 minutes approach. And the second one is the IHI framework for improving joy in work. So this first one, the 15 seconds, 30 minutes, this was developed by Professor Rachel Pilling. She's a consultant ophthalmologist at Bradford Teaching Hospitals and one of the managers there called Dan Wadsworth. Now, Dan has actually left Bradford, but they're both still very much involved in the 15 seconds, 30 minutes approach. Now, they have an entire website with all sorts of information on. So if you are interested, just Google 15 seconds, 30 minutes to tell you more about it. But the theory behind all this, and I'm hoping this video is going to play, but it doesn't look like it's going to, so I'll just talk around it instead, is the idea that you make a small effort to improve something and someone else reaps the benefit of it. So let's see. No, that's not going to work. So examples of that could be something as simple as, this is a biggie for me, I ring a lot of hospitals, or having phone numbers on the bottom of email signatures is incredibly helpful for me. When it's not there and I have to go through switchboard, I find that very challenging because it's very difficult to get to the right people. Other examples are just filling the photocopier with paper, filling the kettle after you've used it, all those really small things, but they make somebody else's life better, even if they don't know it's you. So that's as simple as that is. So that approach, the 15 seconds, 30 minutes, anyone can do. But as I say, there's information on the website about team workshops and different things. Then we come to the IHI framework. So as you can see here, this has these 9 segments, and what each of these are, the kind of proportioned out into whose responsibility they are. So as you can see from all of this, this says that senior leaders are responsible for all of this. But then, of course, we've got team and managers and core leaders who are also responsible for quite a lot of that. And then us as individuals, we also have to have a responsibility and take a responsibility for being happier at work. Now, this has been developed from an organisational perspective, but I do have to say many teams do it and just look at what they can do as a team. So if you're thinking, well, our organisation is big and they're not going to buy into it, well, just give it a rethink, because you can certainly do it at a team level. Oh, that's that. So I'm just going to go through some of the elements within the IHI framework. I'm not going to cover them all today, but I just thought it might be useful just to kind of give you a flavour of them. So the first one is about physical and psychological safety. Oh, what is the IHI? Sorry, I should have mentioned that. So the IHI is the Institute for Healthcare Improvement, and they are the gurus, really, of quality improvement around the world. So again, they've got a really nice website, and you can sign up and you can access lots of resources with them. So say if you wanted to access the IHI framework, you just register, and they send you lots of they point you to lots of information on their website, so it's definitely worth looking at. So that's the Institute for Healthcare Improvement. So psychological safety is the first segment of the IHI framework, and this is it's physical and psychological safety, but I'm going to talk about psychological safety. You really can't, if you want people to tell you what needs to be improved, then it's really important to have psychological safety. So if you haven't got that, or you don't know if you've got it, it's about having conversations around that and then looking at how that can be improved. It's very easy to say, very challenging to do sometimes. So I'm not making light of that, but it is something to be mindful of. Recognition and rewards. We need to say thank you more. We need to be grateful more. And I think there was some research done by the John Templeton Foundation, which found that we're actually, the place we're least grateful is work. And maybe we need to change that a little bit and say thank you more and be grateful for what we get from work. Now, I'm not saying every day is good, mind, so that's not where I'm coming from with that. But I think we do spend a lot of time at work, and hopefully most of us enjoy some of that time we spend. The card in the middle was from the Homerton Hospital, and I love this. So it's called You've Been Spotted, and it says you've been spotted doing something amazing. And I think just sharing that with people, that's a really nice thing to share. It can be done virtually for those of you who work virtually, but also it can be a physical card. The other thing is cake always goes down well as a way to say thank you. I'm sure you know that already. You don't need me to tell you that. But there's lots of ways of recognising and rewarding people for the work they do. I can't really talk about joy in work without talking about wellness and resilience. I'm not going to go through all this, but the key point here is the one in the top left. And I know that Hilda will completely agree with me on this, that self-care isn't selfish. For you to do the jobs you do and to be present and to be active within those jobs we do, we need to look after ourselves. And again, many of you will be in professions where you put other... Sorry, is someone have a question or... No, I think that's stopped. So what was I saying? Yeah. So many people, we work in giving professions. So we often put other people first. Well, it's time to, think of yourself first so you can do a really good job of that. So it's just being mindful of that. The other thing I can't not mention when I'm talking about joy in work is around resilience. Now, I'm not going to talk a great deal about resilience. All I can say is that the most resilient people I've ever met work in health and social care. So I think you're probably all pretty resilient if you're on this call. So, but what I will say is overly resilient people. So this is from the Harvard Business Review. Overly resilient people sometimes stay in jobs longer than they should when they're unhappy in the work. And it even talks about the fact that you are more likely to stay in a bad job than you would a bad relationship. So it's quite interesting that, isn't it? About we just need to think about, are we being overly resilient with that and what are we getting from that? So I just thought what I would do as well as I kind of come to the end of this, nearly the end of this presentation, is share with you some examples of what people have looked at. So it gives you some kind of nuggets of things which give you some food for thought. Now, you need to work out what's good for you within this, so you need to do that. But these are just some pointers, really. So the first one is teams and individuals sometimes look at how they can create a better work-life balance. The next one is sometimes teams and individuals decide to focus on productivity. Now, this isn't productivity so you can do more work. This is productivity so you can finish work on time. So just be clear on that. The next one is sometimes teams want to look at how they work better together. So that's another example. And I just wanted to share this. I do some work in the Northeast for the Academic Health Science Network. And what they do is they do a thing called Wellbeing Wednesday. And it's nice because it gives people permission to say, well, on a Wednesday, we're given permission to do what we want on a lunchtime, and then we can, ideally you do it every day though, just so we're clear on that, but then on a Wednesday they share some of the things they've been up to and some of the things they've been doing. So it's really nice, that sharing, so you get a flavour of what people are doing, and that helps with kind of that teamwork and camaraderie as well. And of course, some teams and individuals want to focus on self-care. So I've talked about that a little bit already, but how you can do that. And as a team, you can do it. So you can go for lunchtime walks, or you can either virtually, or, you can do these things separately, can't you now? And all talk to each other, or you can do it together, or just look at it as an individual. This is something I really like. This is positive gossip. So this is, instead of the negative gossip we hear a lot about, this is about when someone says something nice about somebody, that it always makes the way back to the person who they were talking about. So it's really nice when you get that lovely feedback, isn't it? We all love that. So that's definitely something to think about. And some teams have set that up in terms of they will always give positive gossip. The other thing is having a tidy environment. So whether you're going into a physical environment or whether you're working from home, having a nice environment, whatever that looks like for you, is quite important. The other area which teams do tend to quite like to look at is about communication. Even really good close-knit teams often find that they have communication breakdowns in them, so that's another area where they might want to look at. And it's about celebrating together, isn't it? So it's about celebrating not just birthdays, but it's about celebrating when some good work has happened and celebrating for each other. And the last thing is what some teams do look at is about how they can improve patient care. And that again is something that brings them happiness, that makes their lives happier when they're able to provide an exceptional service. So getting started, this is the 4 steps for leaders, and this is taken from the IHI document. So it all starts with asking staff what matters to you. So if you're in a team and you're interested in taking this forward, to understand what's happening, you need to ask what matters to you. Now, simply, I do this really simply. You can make this as complicated as you want, but basically I ask 2 questions. The first one is, what does a good day look like? The second one is, what gets in the way of that? And that is a great starting point for any discussions. The other thing is, it's from that you can identify frustrations. Now, the IHI refer to this as pebbles in your shoes. So these daily frustrations which you need to remove. So that's something to think about. And then collectively, you make a commitment to improve joy in work. It's a shared responsibility. So it's not, if you're a manager or a senior leader, it's not kind of, well, you said we did. It's you said and together we will. I think there's a definite, it's about all working together on this. And of course, to help with that and to help implement changes and to help implement to help implement changes and to ensure sustainability, it's about using improvement science to test approaches and to implement those. So some of those quality improvement tools and techniques, if you've got access to them. So I just wanted to share this. So this was developed by firefighters, and I just, from an individual or team perspective, it's a lovely way to start having discussions about where you sit on this, what sort of day you're having. Now, obviously, this will fluctuate from day to day, and that's absolutely fine. But as a check-in, if you or your team are struggling part, so what can we do to move that? What can we do to move you a bit further to thriving? So it's a really nice thing just to sit down and have conversations with people. So there's lots of, well, I get asked a lot about how you measure joy in work, and you can measure it in many ways. So you can measure it long-term goals through kind of sickness and absence and yearly surveys and different things like that. But also sometimes you just want to check in with people on a regular basis. So you can do that through what East London Foundation Trust did is they, when they first started out, they had these boxes. I think they might use them still in some departments, although they also use the app, the Improved Well app, which comes with a fee, but it's quite good. So you put counters in about what sort of day you've had, or you can say you're having a good day if you're doing it electronically, yes or no. So it's quite simple that, but you need to be able to then take that information and find out what was causing that person to have a good day or team to have a good day or not a good day. So that's just a really nice way, but there's lots of ways to do it. I'm very happy to share more with you. But the other thing is, what you need to do is not annoy people by asking them all the time. Now, what I would definitely say is, as a team, agree on this, because otherwise, if you set out and say, right, we're going to do a survey and we're going to do it every week and you've all got to complete it, well, it can be very disengaging. So you need to have a discussion about how you do that. The other thing is, counters are fantastic, but how often, are you going to do that forever? People get fed up with these things. So it's about checking in and having discussions. So as I come to the end of this presentation, I just wanted to share this with you. Please do smile more. Even if you smile a lot anyway, smile more. Even if you don't feel like smiling, because when you smile, it sends a trigger to your brain, which makes you feel happier. And therefore, when you're smiling at other people, it makes them feel happier. Now, I'm not saying don't be smiling in a creepy way, but just smile at people and you will make them happy and you will be happy as a result of that. So if you don't take anything else away from today, make sure that when you come off this call, you give someone a cheesy grin. So this really brings me to the end of my presentation, and I guess my question to you is, what will you do now? Or is it that you just need to take away, absorb this, maybe look at some of the tools more? That's absolutely fine. But it would be fantastic if you had a takeaway from today, and you know, that would be great. But if not, that's fine as well. But if you do and you're willing to share that, please do put that in the chat. And that brings me to the end of my presentation. What I would say is, I am the convener of the Improve Enjoying Work SIG, and it would be absolutely fantastic if you're not a member of that already, if you joined. So certainly Hilda's, what's the name of your SIG, Hilda? Staff Wellbeing and Patient Safety, I think. So they do have some synergies, so I would definitely recommend you being members of both. And, you know, follow me on Twitter. I'm forever posting things about happiness at work and enjoying work. And if there's anything you have any queries on, or you want to ask me anything further, please just send me an email. I'm very happy to help.